Stop.
Jim, how do I know my video is off? How do I know my video is off? I'm behind you.
Sue's kids in the background.
So everyone, if you want to put your phone on mute for now, that would be great. And then at the end, I think we're going to have a discussion. And so then everyone can turn their microphones back on.
I'll tell different people. I'm not doing it. I go into here. I have this off, that's why. That's his wife, huh? Did you ever meet his wife? Yeah.
We'll give it just 1 or 2 minutes more, and then we'll get started here, everybody.
Is this like a podcast? Like me.
Do you see my name come up? My name here?
Yeah.
I think I'm gonna turn down off. It's really loud.
When prompted, select yes.
Wait a minute. What did I do? What was it? Oh, here it is. What did you want me to hit? Prompted?
Oh, no, nothing. Oh, those are all people clicking in, maybe.
Yeah, 129 participants.
Someone signing on. Is that me over there? No.
No, these are. Well,
Oh, those are. That could be a participant.
yeah, this is a participant, right? Because there's my name.
All right, we're gonna mute everybody here. We're gonna everybody. We're gonna mute you all now, and then we'll get started here. Okay. 33.
As I say, make it bigger.
Dr. T. All right. Oh, participant.
Sorry.
All right, everybody. Here, let's do the video here. Just click on this.
Yeah, we're all starting.
No, just look at have a screen.
They see both of us. They see both of us. They'll see us.
You see both?
Yep.
Yeah. All right. Well, as you all can tell, Jessica here is the expert on everything, including usage of Zoom. I know how to participate, but facilitate's a whole other story. So welcome. It's a few minutes past 8:30, so we're going to get started here. We want to also welcome Dr. George Papanicolaou is on with us as well from afar. So respecting the distancing, even on the conference tonight. So thanks for joining us. It's really, I think, a pleasure and a responsibility and an honor to be able to pull together in these times of challenge. We know that everybody's got a lot of emotions wrapped around this COVID crisis. We thought this was a really timely presentation to make, particularly where we're at here in Massachusetts, or maybe people joining us from outside of Massachusetts, and there's different scenarios occurring all over the country and around the world right now. But I think Jessica here has provided some information for people. A lot of you have seen her post on Facebook. She's also done a couple of smaller, more informal presentations for folks and illustrated the timely juncture and the fork in the road that we are at in Massachusetts. And as you saw from the agenda outline listed on the website, we're intending for her information to be insightful, empowering, educating, and hopefully covering a lot of the questions that a lot of people are asking out in the public. And then at the very end, as a much more minor piece of the presentation tonight, Dr. George and I will provide a little clinical application and information. But without further ado, I'm going to turn it over to Jessica to introduce herself.
Hi, yeah, so thanks everyone. It's really exciting to be here. my background is I'm an epidemiologist, and my key phrase right now is, prior to COVID, no one knew what an epidemiologist was, and now everyone does. And that is, we study epidemics, various types of epidemics, whether they be infectious diseases like COVID, or even things like the obesity epidemic, which has really overrun America. So I'm an associate professor at Harvard Medical School and Brigham and Women's Hospital. And with all that we see in the news, we see a lot of drama, we see a lot of, oh my goodness, scare tactics and this and that. And what my hope is tonight is to sort of tease through that and talk about the reality of the situation and what I think it's important for us to understand in terms of severity and what the necessary responses are. And what I think as the whole community and you know, the whole US, we should be doing to most adequately respond to this virus. So that's why I entitled this COVID, an epidemiological perspective. So I'm going to start, let's see here, I can get my screen to, there we go. I'm going to start with just going through the general outline of what we're going to talk to tonight. What is the COVID-19? Why is it so dangerous? Is it bad? How bad can it get? What do we need to do to stop it? And what are scientists doing to help? So I'm going to give you just a very brief cartoon illustration of what happens when you actually contract the coronavirus. So the coronavirus enters your body and it attaches to an external cell called an epithelial cell. Most often those are actually the cells lining the lung, but they're on the outside of the lung. Then it attaches to that cell and it tells the cell, I want you to replicate me. And it shoots its RNA in here. And the cell doesn't know better. And it says, you replicate me and recreate me. And so our epithelial cells say, okay, that sounds good. We'll recreate you. And this is one epithelial cell, and each of these red dots are different coronaviruses. And the cell just keeps on creating and creating and creating these coronaviruses until the cell gets really, really big. And then it basically explodes and releases all of the coronavirus into parts of your body. This slowly happens, and as you can see here it's starting to happen, but this really happens in an exponential rate, and all of a sudden your lungs are filled with coronavirus. Now, what does the body usually do to react to this? Whenever we have something invading us, we have an immune system that tries to react and fight against it. So our whole immune system goes, da, 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 and it says, we need to respond. So your immune system then comes to the rescue to try to fight against the coronavirus. Now, this is typically a good thing, but in the case of the coronavirus, and the same thing happens often when you see like an anaphylactic response or something, what happens is our immune system actually overreacts and doesn't actually know how to react correctly. And that is that the immune system, we can understand, can actually be dangerous. And what actually happens is those immune cells enter the lung, and the coronavirus actually infects them. And then they become confused and they don't know what are good cells and what are bad cells. So then they start like killing good cells as well as bad cells. And now they're killing all the good cells, and you're getting even more sick. And your lungs then progressively get more and more invaded by more and more of these immune cells, and it does a tremendous amount of damage. Now, in most cases, our body eventually figures out what's good and what's bad, and it resolves. But in the case of what we're seeing a lot of times with ICU patients in the coronavirus, they have so many immune cells coming that it's creating a lot of excess fluid, resulting in difficulty breathing, and all of a sudden people's oxygen levels go way, way down, and that's why they need to be on the ICU and ventilators. So that's sort of a general idea of what is actually happening. Now, just to answer a few other questions, one of the questions that's been answering is, well, is the coronavirus the same as what we initially saw in China, or is the coronavirus actually mutating? And this is actually a map that shows how many strains and mutations the coronavirus has had. What we can't see over here, oops, it's all the way over here, is it started out as purple, and this is sort of a tree diagram. So every time it splits into different mutations of the coronavirus. So what we see is what actually happened in China is different than, it's slightly different than what we are seeing in Europe. And what we are seeing in Europe now is slightly different than what we're seeing in the United States. And why is that important? Well, it's important for many reasons, because as these mutations happen, the virus may be either easier or more difficult to kill. And that becomes then important when it comes to treating patients. So I'm not sure how many of you have actually seen this website, but Johns Hopkins Medical University has a website that they update daily on the number of reported cases throughout the world. And this is, I'm showing you this just for your own information when you want to actually look and see, you know, what are the case counts at. And what's amazing about this is you can also sort of see the trajectory of how the disease and how the coronavirus is moving throughout the world. I've been watching this very carefully for 3 weeks, and the total number of cases in China in 3 weeks has probably gone up about 1,000. And the number of deaths have stayed almost exactly the same. 3 weeks ago in Italy, there were almost no cases. Now there are almost 75,000 cases, and the death rate in Italy is over 10%. Now, I just want to contrast that to China. The death rate right now in China officially to this day is 3.9%. The death rate in Italy is over 10%. The US is sitting in here at what it says is 61,000, but one of the things we know is we have not accurately tested our population. So that number is probably drastically off. So we can actually look at this in many other different realms. You can go down and actually look at state. And I think it's really interesting when you look at state, because 8 days ago, Washington State and New York State had almost exactly the same number of cases. They had about 600 cases, both Washington State and New York State. So you see within the span of 7 or 8 days, Washington State has stayed at 2,500 or less cases, whereas New York City or New York has blown up to have almost 31,000 cases. So one of the things I want to talk about tonight is, what is that difference and how can we prevent that? Or even if we're living in New York at right now, how can we maintain it? For those of you who want to know, the updated count in Massachusetts right now is 1,159. I say all of this with a caveat that all of these numbers are drastically underreported because we actually don't have sufficient testing to really accurately come up with these numbers. Another thing is we can actually go down all the way to the, what's it called, as county level. So for example, in Essex County, right now there are 118 cases. 2 days ago, there were 60 cases. But that gives you an idea of where it is. And one of the reasons I bring this up is it gives you an idea of what the trajectory is like exactly where you live. Middlesex County, which is another county right near us right here, is quite a bit higher, almost 3 times higher, with 304 cases. So why do I bring all this up? You know, why do I talk about things like we look at Washington, and the state of Washington, you know, over the span of 8 days has gone from like 600 to 2,000, whereas New York has gone from 600 to over 30,000. I want us to think about that. And the important thing is, how can we prevent that from going further? But when we think about this whole epidemic and we're hearing about it in the news and we're hearing people talk and, oh no, you know, we should be so worried. And then there are people who say, well, it's just like the flu. It's not that big of a deal. You know, it's really not that contagious. I want to just give you 2 numerical numbers that epidemiologists use to quantify a disease and how serious the disease in terms of its spread and its overall impact on society. And there are really 2 quantities. The first is a quantity called R0. And it's a really simple quantity. It's measuring basically if you are sick with the disease, on average, how many people do you transmit that disease to? And we see the seasonal flu has an R0 of 1.3. So that means on average, a person transmits it to 1.3 other people. So, less than 2. COVID right now, it has a range. It has a range from 2 to 3.1. Well, that doesn't seem that bad compared to the flu. But, you think 3.1, that's pretty much 3 times the rate of the flu. Putting this into perspective, though, the measles has an R0 of 11 to 18. And one of the things I heard Anthony Fauci say recently was the measles is so contagious. If you went into a room of 100 people and one person had the measles and they were just sitting there for an hour, no one touched each other, nothing else, 90% of the people in the room would get the measles at the end of that meeting. That is how contagious the measles is. So we aren't looking at something as contagious as the measles, but it's certainly more contagious than the flu. Now, one thing I want to point out, and this is going to become a crucial point. So I'm looking at you saying, crucial, we can change R0. And that is empowering to us to know that as a community, we have the power to decide if R0 goes to 10 or if R0 goes to 0. Now, the key thing is once R0 gets below 1, we see cases drop because on average, we are having less cases than, fewer cases are developing than currently have it. So that's when we see the cases drop. So right now in China, R0 is way below 1, and that's why they're not having new cases. So that's one measure that is important, R0. How many people do we transfer it to? The other is mortality. And of course, this is hugely important, right? When this disease first came out, people were like, well, what's the big deal? It looked like it had a mortality of about 3% in China, and it's mostly the elderly. That's really not that big of a deal. While that is true, I want to point out that the mortality in Italy right now is greater than 10%. And my sense is by the time this is done, mortality in Italy likely could be as high as 20%. And that is scary. But to empower us, I want us to remember that like R0, we can also impact the mortality. So as a community, as a society, we can impact the 2 major things that are essential to make this disease go away. Okay, so let's talk a little bit more. So right here, I'm saying we can change both R0 and mortality, and really that's up to us to do. And whether we may have some people who are in power who may not be the most educated about this, we also have other people who are my heroes who have amazing experience with this. Anthony Fauci has been at the NIAID since 1984. He's lived through the AIDS epidemic and really was single-handedly the person who eradicated AIDS from not only this country, but a lot of Africa. Not single-handedly, but he had a huge involvement in that. We also look here when we say we can impact both R0 and mortality. I have up here, here's a success story, and we're going to be talking a lot about Korea. Korea has really dramatically changed both R0 and mortality. And as well as China has dramatically changed their R0 right now. Other places such as cruise ships did the opposite in terms of their R0 went through the roof because they made people stay on the ship and then everyone got it. But how could we be smarter than the cruise ship? And how can we be smarter than the cruise ship even with who may be leading the country in one way or another who may not be as knowledgeable as others. So how can we do that? Now, I'm going to talk now about 2 very annoying terms because that's all we're hearing about now. So with the acknowledgement that they're super, super annoying, I want us to really critically understand why they're important, and not just from this simple graph I'm showing here, but from really quantifying what this means in terms of overall mortality percentages and numbers in the United States. So we're going to be talking about flattening the curve and social distancing, and why those two are important, and really what are the challenges we have in doing that, and how over time are those challenges going to change. Okay, so I want to rewind a little bit in time. We are now talking about, the date is March 4th. On March 4th, we were all going to restaurants, we were drinking wine, we weren't thinking about this at all. We saw the little pictures of people in China, you know, oh my goodness, some of it's happening in Italy now, and South Korea, you know, but we were just living our daily lives, really not paying attention. And if we look at this map right here, what we see, and this map does not include China, but this includes all the other countries, we look at this and we're like, whoa, Korea went from the 20th to the 14th, so that's in 2 weeks, from 0 cases to 6,000, exponential increase. And we think to ourselves, they are doomed. And you know, you look at this and you say, well, Italy, you know, Italy's following this, a similar pattern, maybe a little less than Korea, but a similar pattern, they're probably also doomed. But really, the eyes on South Korea, they are gonna get it, and they are gonna get it bad. So that was as of March 4th. I now want to fast forward this to a more recent version. So what we saw before was in this dotted line, but I now want to expand that out now from March 4th until March 18th. And the two countries I want to focus on are South Korea and Italy. I mean, when we looked right over here, remember we just said, whoa, South Korea is in major, major trouble. They are going to have a ton of cases. They're already at 6,000. We said, well, Italy has the same trajectory, but you know, it's still, you know, maybe it's a little bit lower than South Korea, but you know, South Korea is doomed. Look what has happened in the last 14 days. South Korea has basically gained minimal number of cases, and they're almost flat. There are not, now this is what I want to point out, there are not, from right here where it was probably 3 or 4 to here where it's probably 1.2, they dramatically reduce their R naught. And when you dramatically reduce your R naught, you also dramatically reduce your mortality rate. In contrast, Italy didn't do things quite as fast, and their mortality rate and their R naught shot up way even higher, especially mortality, because now we're in this situation where they don't have enough hospital beds, they don't have enough medical equipment or anything to handle cases. People are literally dying in their homes and in the nursing homes. So I want to take these two cases, South Korea and Italy, and talk about how we can be South Korea and not Italy, which is somewhat in our control and somewhat not. But as we move on, it's going to be more and more in our control as long as we do the right steps now. Okay, so this is an illustration of what is going to happen in the US if we do nothing. Okay, now these over here are number of deaths. These are number of deaths, these are number of people. So if we do nothing, and these transmission rates, this is an accurate population for the United States. When we look at R naught here, it's 2.4. That's actually probably relatively conservative. So these different parameters that they're putting in here are probably pretty accurate. They have some of these a little higher because once you get above the number of hospital beds, things go up. But what I want to point out here, with the number of people in the United States, if we do nothing, we will have over 25 million cases. And we will have over 10 million deaths with nothing. So I want to put this in perspective, because when we see the numbers now and we see the news say, oh my goodness, we have 500 cases and 500 deaths, or we're close right now, we're close to 1,000 deaths. That isn't anywhere near how this could go if we are not putting in the right protective measures. So part of the good news is we are putting in some protective measures. But we're going to talk a little bit about that and what else we can do and what is on our side and what's not on our side. Okay, so here, if we take that same graph and we look at if we did nothing, this is what I want you to grasp in terms of numbers. When we talk about flattening the curve and you see the little curve that's really, really high, and we say we want to be below the number of, below where the hospitals are so everyone can be, who is seriously ill can be in the ICU. I want to give you an idea of how drastically far off of that we are. We are not off of that by like 10,000. When you look at this red dotted line indicates the number of ICU beds in the United States right now. And this indicates, in a case of doing no precautions, the number of people who will need to be in the ICU, which is about 2.5 million. Okay, basically, with the number of ICU beds, that's almost like at zero when you have 2.5 million people who need it. That does not even include the number of hospitalizations. So I'm saying with no precautions, that is the gravity of the situation. I mean, the gravity of the situation is we are short over 2 million ICU beds. That is the gravity of what's happening if we take no precautions. Okay, so I'm now going to switch really quickly to this concept of social distancing, just to really nail this point through very quickly, because I think it's important. So I'm going to stop sharing this, and then I'm going to share my computer screen to actually get to this website very quickly. If I can do that. And I will reshare so you can get a visual illustration of what exactly I'm talking about. Let's see here. Okay, so I'm going to reshare here. And I'm just going to share my Safari. There we go. Okay, so I'm assuming people can see my Safari now because it is it says I'm sharing it. So I just gave the example of what happens if we do absolutely nothing. I want to just give you an idea of what the concept of social distancing is, and people have likely seen this, but this will give you a really good idea of what social distancing does, okay? So here's an example where the orange dots are people who are sick. And this is over a period of time. If there's no social distancing, you see very quickly the rate and the number of people affected goes up dramatically high. And those that recover, meet it, but we see this huge, huge spike. If we go to a scenario, this is actually, we'll do this one really quickly. This is a scenario of like what happened in Wuhan, where they had a quarantine within Wuhan. But the issue is, of course, quarantine never works perfectly. So all of these people are affected here, but then they escape. No one has it over here. And as soon as they escape, if there's no social distancing going on over here, then you'll get a big spike of people over here because there's no social distancing happening there. So you see, this is during the quarantine period, then they escape, and then the cases go up. Now, this is what I would call moderate social distancing right now. So you see, this is a lot of us staying in our home, but we do go to the grocery store. We may not be washing our hands. We're going on walks, walking too close to other people. Our friends have a play date over, or our teenagers get out and they're on their bike and they end up playing with their friends and they're not even telling you. Now we see there is a much more flattening of the curve, and the cases happen slower. Now as we're talking, I want us to remember what the important thing about this is. Flattening the curve is about one thing, and that one thing is time. And I will get to that a little bit later as we go on. So here is an even more extreme case of social distancing, which, people who are putting really more extreme measures in place, like governors like Charlie Baker, is really trying to put us in this scenario where we limit social distancing as much as possible. We get a minimum number of cases, and we really stay flat underneath the curve. While we hope that happens, that also takes a level of reinforcement that I think in our community can often be hard. It's much more strictly enforced in a country something like China. Okay, now I'm going to go back and share I'm going to go back to my PowerPoint here, and we will continue with that. Okay, so now I want to go back to this case here where we look at Italy and we look at South Korea. Now, we just saw, and likely you guys have seen some of those simulations before of what social distancing can do. But that still doesn't really explain this difference, right? Because you look at Italy now, and they are completely social distanced. And while some of that is definitely because they did it too late, and a large amount of it is that they did it too late, I also want to talk about another concept. And this is a very important thing to understand the difference between these two. When we implement things like social distancing and hand washing, what we are actually doing is we are doing mitigation. That means we are trying to prevent the spread. Mitigation is great. It's absolutely great. But that is very different from suppression. And suppression is where we really want to be. What is suppression and how do we get there? Suppression is what's happened in China and South Korea. And that is, they have taken much stricter measures with anyone walking around. They have severe consequences with social distancing. They have cases recorded accurately on time and tracked. And when they do all of these things together, and when you know where every single case is, then you can isolate them very easily because you know where they all are. And this gets under control very fast. And you see the number of cases plummet and the disease go away, which is what's happened in China. So that is suppression. Now, unfortunately, the US is not in suppression at all. We're just in mitigation. We're just doing the social distancing and washing our hands. And why is that? And I want to talk a little bit more about how do we get to mitigation. But let's just look at this. This is the case if the US were to get into suppression. So if the US were to have everything right now that South Korea and China have imposed and taken all of those measures, we know where every single case is in the United States, and we were tracking this. I want you to grasp how drastically different the impact of this disease is. You know, now instead of we only go up to 40,000. Now last time, under the case of nothing, we were at 50 million. So we have dropped over, 3 magnitudes in number of infected individuals. 3 magnitudes. And when we drop 3 magnitudes, the total dead goes from 10 million to 4,000. I mean, that is a tremendous difference on the overall public health impact, the overall devastation in the economy. The other thing about suppression is when you do it, it happens fast and you can move on. And that is illustrated in what you're seeing in China and Korea. Korea is at a point where it's going down, and if they keep up what they're doing, they're going to be in a place where they can reopen up a lot of the restrictions they had. So how do we get in suppression? And one thing I also want to point out here, remember what I said, the key thing with suppression is getting this R0 below 1. And what's interesting is even if this R0 is not this low, even if it's like 0.9, still you're in this realm of infected and number of deaths compared to what we're seeing right now in this exponential growth. Now, this is hard to see, and I just want to go through this briefly, because the question is, how do we get ourselves in mitigation, and what's in our control and what's not in our control? So this is a summary of looking at countries who've been good at getting things in mitigation.
Mitigation and suppression.
Oh, sorry. Suppression. Countries that have been good at getting things in suppression versus those that have not been good at getting things in suppression and are only in mitigation. Now, I can go through this list in detail, but I want to just highlight a few things. Those countries that are in suppression have done a tremendous job with detection and isolation. Look, all of them have done it. They have a government who has done a lot in there. They have done a lot for public care decontamination, and they have adequate healthcare resources. When you look at Europe, they haven't done all those things. They've done some, but not all of them. When you look at us, I hate to say it, we're sort of a disaster. Now, when you look at the other part of this curve, what are the consequences of not putting those other things in perspective? So what are the consequences of not identifying and tracking cases? One of the big consequences is having to close everything, close schools, close public education, stop gathering. So you look, that Europe has done all of these things, all these social distancing, isolations, travel bans. The US now is doing much more of those. But what I want to point out is actually, if you are in suppression and you are monitoring all of those cases very carefully, it actually enables you to do a lot more in terms of opening things up and not having as many things closed. Now, the social distancing still really needs to happen to a large degree, but my point is there's a lot that doesn't need to happen. Now, because we are in a case where we don't know who's infected and who's not infected, I completely support, and we have to close everything because we don't have any knowledge, and that's the public health best thing to do. But my point is, if we get that knowledge, it is not as prohibitive as one might think, and still be in a period where we start to be in suppression. Okay, so what is the issue here? How can we get into suppression? There are two simple things. We need to test everyone and track and isolate all cases. The US cannot do suppression without doing that, and will stay in mitigation until that happens. So right now you may be thinking to yourself, okay, Jessica, this is all great, but this has zero impact or relevance on me because I can't do anything about any of this. And that is right. You can't. I hear someone who's not on mute. So if you're not on mute, could you put yourself on mute? So I want us to think about this issue of how can we, we have to acknowledge where we are. And where we are is right now, we are not able to test everyone, track and isolate all cases. So what do we do? Well, our number one goal should be to get to that point where we can test everyone, track and isolate cases, because that's how we get into suppression. But until then, we're in a different scenario. So let's look at our scenario and then talk about how we can respond. Our current scenario, nowhere near enough ICU beds, N95 masks, respirators, not enough tests available, no tracking of cases. We really have no idea what the true extent of the problem is. No vaccine, no treatment, and for goodness sake, we don't even have toilet paper. It's a very rough time right now. But I want to point out the most important thing for this moment, and that is, with what has been put in place, given that we can't do anything about lack of tests, we can't do anything about not being able to track, what is on our side? And what is on our side is exactly what mitigation will be doing by flattening the curve. What is flattening the curve going to give us? And if we flatten the curve as much as we possibly can, what is it going to give us? It's going to give us time. And time right now is crucially important. And when I say crucially important, every day is crucially important. So every day we can prevent greater spread of this becomes our ally, because every day we give ourselves, we get more comprehensive testing, we build capacity, we get more ICU beds, we get more respirators, we get more protection, we get more testing, we get more research, we get closer to a vaccine, and we get closer to a treatment. So when we're all sitting there frustrated, asking like, why are we doing this? It's ruining the economy and this and that. We're doing this to prevent 10 million deaths, which is what's going to happen if we don't do this. And we're doing this to give us time so that we can put the precautions in place and really get us so we can get into a place of suppression. Okay, so I just want to close, I just have a few more slides here, and I want to close with a few things that are hopeful. And that is, with time and suppression, what can we get? We can get vaccines and treatment, and I really want to talk a little bit about what the current status of that is. And, as we look exponentially, the number of research articles on COVID-19 is increasing. And the vaccines are really coming along. Now, I actually work pretty closely with someone who is likely going to be leading a lot of these efforts in terms of the vaccine. And I'm going to stop and share a 1-minute segment on where that is right now. And my caveat is when I share this, there is some discussion in here about this being tailored to the elderly, but suffice it to say that this vaccine is efficacious for all. So I'm going to quickly show you that so you can get an idea of where we are and how long it's going to take to get the vaccine. I'm going to share. Sorry.
With associate employment and compensation returning once our business resumes to its normal state from this unprecedented stoppage.
Yeah, someone should please keep their mute. Right, hold on. Oh, sorry, hold on a second.
Wait, stop. Yeah, close that.
Okay, I'm gonna do
Is this
this.
being shared?
Yeah, so can everyone should see my screen right now?
Nice folks could be your mother, your dad, your uncle, your aunt. People over the age of 60 are the most vulnerable when it comes to coronavirus, but there's hope. We're trying to discover rocket fuel to make a vaccine work better in the elderly. Dr. Ofer Levy leads a team of researchers. They're focused on helping elderly patients. Here's how it works. By now, you've seen a coronavirus cell. Those little reddish spikes that stick out from it are called spike protein. Key approach for a vaccine is to inject just the spike protein, not the live coronavirus, just the bit of the virus that it needs to get in. Because if we inject that into an animal model, for example, a mouse would make antibodies against that, and those antibodies would block infection. So in humans, that would prompt your bloodstream to fight the virus if you were infected. That's how a vaccine would work once it's discovered. But we need to scale that production for hundreds of millions or 1 billion doses. That's far from trivial and very expensive. That's where your grandmother comes in. Levy's lab, which is also run by David Dowling, PhD, takes blood samples provided by senior citizen volunteers, and they search for a molecule that specifically boosts how well a vaccine would work in elderly patients. And a lot cheaper to make than a regular vaccine, so far more people can get vaccinated. That's a huge public health win. The big question, how soon might we be able to have this vaccine for use in the public? We're talking months to a year plus. This is not going to happen in days to weeks.
Okay, so I'm going to go back to the last few slides here to just finish up the talk. But putting this in context, Ofer is a good friend and colleague of mine, and he actually called me last night to discuss working on the coronavirus vaccine and this project with him. This is ramping up in a huge way, and there's going to be tons of investigators working on this, a lot of them in the Boston area. It's at sort of a critical point, and we are moving as fast as we can to get this going and get the vaccine out there. But it's quite a ways in development. Really, the problem with a vaccine at this point is not necessarily creating it. That part of it, I think, is going to happen relatively expediently. It's doing it on a mass level where you're doing and giving the vaccine to millions or billions of people. And really, one of the last thoughts I wanted to point out over here is why is that important? And it's this whole concept of herd immunity. If we can actually vaccinate a large percentage of the population, then everyone's immune to COVID. So the more people in the population that get vaccinated, even if it isn't you, is going to benefit you once the impact of herd immunity starts going into play. So my last few slides here, I just want to encourage us that there is hope. Right now, we have to stick with what we can to mitigate as much as possible through social distancing, washing our hands, working together to really reduce the number of cases as much as possible, while we are holding out for much more accurate testing, much more better tracking of people, so that we can then hopefully get ourselves into a place of suppression. And support those who are working on the front lines. And if anyone knows how to make toilet paper, that would also be helpful too. I just want to close with this. It's funny, I have a talk, and this is a talk I put in a lot of my slides at the end, talking about all the people I work with, and I realized it was relevant here. If we see this movie Free Solo, describing this person who climbed El Capitan basically with no protection, I think the key thing for us to remember now is, if that's how we think of this, we aren't going to be successful. We have to remember that there are people in the community, there's international help, there's biochemists, there's MDs, there's scientists, and there's the next generation who sometimes we may need to put in line. But it's all of us working together to really make this happen as a global community. So with that, I'm going to stop my part and let Mark share, and Mark and George talk about a little bit of their part.
All right. Thanks for that very informative and incredible discussion, Jessica. I guess Dr. George and I just want to spend just a few minutes talking about some clinical matters pertinent to the topic at hand, because that's a lot of what everybody's dealing with, sort of with where the rubber meets the road. But ultimately, we don't want to spend too much time on this stuff, largely because we know there's a lot of people on this meeting who aren't necessarily patients of ours, and we don't want to sort of create any conflicts with any practice management approaches by any other folks in the medical community. And as well, more importantly, we want to really keep the focus tonight on what Jessica's talked about, because a lot of the point of this discussion was really to answer those questions about the questions we hear a lot of people talking about, both professionally and socially, and that is, we really need to do what we're doing so aggressively. Is it really that important? And secondly, on a more personal level for folks, how much do I really need to take this? How seriously do I need to take this? How far do I need to take this? Sequestering and social distancing and quarantining and such. So I want to tag off just briefly on what Jessica just mentioned, that despite all the potentially grim outcomes and trajectories and such, there's a lot of reassurance and hope to be had here, and to restate that a lot of this stuff is under our control, but it's a team sport, it's a team game, and it's in some ways it's our communities, in other ways it's our half of the state, our region of the country, our country, other countries. I mean, the layers of the onion just are numerous. So, despite the numbers that she listed, the potential of 10 million people, is it 10 million people dying? I mean, let's also remember that the far majority of people who can or will become ill are going to be okay. This isn't the plague type scenarios we hear about in the movies, zombie apocalypse. Most people will be okay. We do need to be more attentive to those who are older for reasons we're not going to get into as to why that's the case on tonight's call. There are also a lot of things that can be done to help people who either become sick or develop a worsening sickness once they are sick. So our real intent is to keep the curve flat and prevent the illness, but it's also to say, if someone does become sick, the medical community is very alert and aware of what's happening. There may be a lot of deficiencies right now or insufficiencies with the systems, but there's a lot of work being put into to improving that. And I think there's other physicians on the line here who are local, who we can say with confidence that even with the weekly calls with the energetics, we know the kinds of efforts that they're making, and we ourselves have friends who are in other states and other hospitals who are all doing the same, segregating and splitting the COVID and non-COVID patients and cases, and attempting to both in the ER as well as in the hospital. The testing is a whole big story. I know one question that a lot of people are asking is, how come so-and-so is getting tested? What are the criteria, the thresholds? A lot of people are asking, how do we, okay, we know that there are asymptomatic people getting, who are positive. How do we know that? Because people like in the NBA have been tested positive and they're not symptomatic. So how did they get tested? Yeah, there's unfortunately, it's not a, there's a lot of loopholes in the system. And so there are leaks in criteria per se, and there's arguments to be made. I know that even in the NBA, for example, their comment was, well, they were following public health policy because there was a positive case, and so everyone who's in contact needs to be tested, et cetera. It's just not a black and white story. That's the bottom line. And so there's a real, I guess the second point of 3 that I want to make tonight is, we're just asking, I think we could all do ourselves well and each other well to understand, as much as we might be scared and anxious, to have some patience and recognize that everyone is doing their best to make this work out. In terms of the medical system, there's a lot of balances, and to try to, there's a lot of balancing with dilemmas and difficulties in decision making. On the one hand, as Jessica was talking about, those countries that have done well, they tested everybody, as she said, right? They tested the people who were symptomatic and sick. They tested people who were contacts of someone who tested positive. They probably tested people who were households of someone who was in contact with somebody for only 20 minutes. I mean, but that's the thing is, they had plenty of supply for testing. And so right now, we're just not in that position where we don't have the supplies. That is, again, going back to the take-home message tonight, that this distancing, this quarantine, the mitigation, and arguably even suppression in some cases, or maybe moving more towards suppression, becomes necessary to buy the time until we have those supplies. If we don't do it, it's just the numbers are kind of tale-telling. So whether it has to do with testing or whether it has to do with equipment or hospitalizations, ER visits, whatever the case, we're just in a dilemma right now until more is available. A brief word on treatments. Again, there's a lot of people reading a lot of different things, social media, internet, news. Donald Trump has talked about various promises or great hopes and things of that nature. We're not going to get into that tonight. We don't want to detract from the real take-home message tonight. But again, the message here is that there are options. Some are in evolution, some are under study, some are more well established in other countries for usage and practice. And so, everyone's doctors are doing the best they can, and it's okay to ask those questions. It's okay to have the discussions and dialogues about them, but we do want to constantly be mindful about, again, the panic and anxiety that we are generating. And certainly we could make point, and I think I'll leave that to George later, that the anxiety itself, I think when we talk about, Jessica talked about that it's not just about the virus as a pathogen causing disease, but it's our immune system and how we react to the disease. And boy, that immune system is a really big deal. And that stress that we have as part of this reactivity to the phenomena itself is not doing us any good. So whether we talk about treatment options or we talk about testing, or more importantly, if we use this opportunity to take a good look at what are we actually doing with our gut health and our immune systems as a whole, our lifestyles that have really put us in a position right now to individually and arguably as a population to be where we are. If we were to spend some time, we're not going to tonight, but if we were to spend some time talking about the science behind the evolving science and understanding about why certain people get sick more than others, whether it's age related or it's gender related, males more than females, etc. There's a lot of interesting commentary about that, or developing understanding. George and I were just on a webinar prior to this meeting, where they went into great scientific detail. But the point is, a lot of that has to do with the health profile of the individuals in the population at large already prior to the onset of this infectious pandemic. And so when this passes, and it will pass, it is very reasonable, and we would advocate that we all take some time even now to stop and think about the underlying foundations of our health. So with that in mind, with that in mind, let me pass it on to Dr. Papanicolaou. How do we unmute him? We got to find him.
He can.
George,
George,
George can unmute himself. Yeah, that's right. George, do you want to take the microphone here?
I'm very rarely muted, but I unmuted myself. So it's really interesting that while we're self-distancing, we're probably getting closer to each other than ever before in different ways. And so using Zoom and other technologies has been really amazing. I know as a dad of 3 that I'm commonly trying to get my kids off of screens, and now I do everything, all my work is on the screen. And this is a great opportunity for us to realize that we're all together. Even though we are distanced, we are coming together as a community and as a country and as a world. And one of the premises of my discussion is that as an osteopathic physician, one of the principles of osteopathic medicine is that the human body is an integrated organism in which no part acts independently, and that the human body has the ability to self-regulate and self-heal. Now, there are other principles, but those 2 are really important because it speaks to how we understand our own health and how we maintain that health, how we protect that health as we age. And the other reason why it's important is that the earth is a living organism. It's a living organism. With interdependent systems, none of which act independently. And that has implications to why we may be experiencing this virus as a pandemic and why we've experienced them in the past. So that's the main premise, and it sort of structures the bookends what I want to talk about. And so the events that we're going through right now are creating a huge amount of stress, obviously. Stress is having global implications. It's having personal implications. Global implications on our environment, personal implications on our immune systems. Okay. So again, laying the groundwork for where I want to go with this is that as a doctor, currently the questions I get are the ones that Jessica just answered and that Mark alluded to, the ones that she answered. Well, how long is this going to last? Why are we doing what we're doing? Is there any end in sight, and what will be the parameters for it ending? And Jessica just in a very eloquent way showed us all how that's going to play out. I also get questions about, well, what do I do to prevent getting sick? What do I do if I do get sick? And everybody wants me to tell them about the magic drug or the magic supplement, and that happens because there is no clear-cut treatment. And when there's no clear-cut treatment, then everybody's going to look for treatments, and they're going to look to alternative treatments. They're going to even try some of the treatments that are available, like chloroquine. And sometimes in a very dangerous setting, there was a couple that actually died because they used a product that had chloroquine on it, and they thought that was the same as the chloroquine that's given out pharmaceutically, and it wasn't. It was toxic, and unfortunately, the husband died. It's that type of panic and misinformation that needs to be quelled. So when I had that question asked, I don't go to supplements. I go back to my thinking that I was trained to understand that the body is an integrated organism, and all the parts work together. And so I have a matrix of thinking. And the first place I go is I go to lifestyle. And here's what's really important, is that just to take a quick aside, the majority of the deaths are occurring in adults. And I have a little slide here. I'm not going to share, but it's here for me. Currently, the death rate is 14.8% 80-year-olds. For 10 to 19-year-olds, the death rate's only 0.2%. Only 0.2%. So people have asked me, why aren't the young getting sick? Well, there's some theories about why that's happening. One is that younger children have stronger immune systems. Their thymuses are still active when they're very young, and as they age, as the thymus shrinks down, they still have stronger immune systems. The young have higher levels of melatonin. Melatonin has been studied and has abilities to suppress the COVID virus, or I should say viruses, and coronaviruses. And they have higher levels of antioxidants. So why is the 85-year-old, why are the people above age 60, why are they having struggles? Because as they age, their immune systems start to decline. And they begin to have, and they also have waning melatonin, they have waning antioxidants, and their immune systems slowly decline. Antibodies that they had built up against viruses when they were younger start to wane, and their immunity now has declined. So the principle is this. This virus is a wake-up call for all of us, globally and personally. We can't wait until a virus hits us, or we can't wait until we wake up in the morning and we can't remember our wife's name. We have to begin early so that we're prepared, so we don't run out of the N95 mask, so that our immune systems maintain their integrity until we're 70, 80, 90 years old. Okay, how do you do that? Well, you do that by paying attention to the basic things. So I don't start with supplements. I start with how you sleeping, right? What's your nutrition like? Are you exercising every day? How are you handling stress? And do you have toxic relationships in your life? Those are all the things that erode health. When I have patients come to me with complicated illness, tick-borne illness, biotoxin disease, autoimmune diseases, they come to me after many years of struggling in conventional medicine and not getting where they need to be. I can employ a lot of tests to help get to the root causes of disease. I can even tell them, these are the things we need to change in your diet, and these are the things that we need to change in your sleep. Because if I can't get them to do that, anything else I do, any other targeted supplements, any other drugs that I use will not work if a person's stressed out, isn't sleeping, isn't exercising, and isn't getting proper nutrition. That's where you have to start. You can't drive through the Dunkin' Donuts drive-through, pick up your 16-ounce sugary drink, have your donut, and then take your little COVID-19 immune support pack of vitamin D, zinc, and quercetin, and swallow that down and think that you're doing any good to protect yourself. So if you want to have a strong immune system, it starts with the basics. What we're doing right now, this blue light, is actually diminishing our melatonin. We need melatonin to sleep. A bunch of you tonight are going to have a hard time sleeping. You're probably already sleep deprived. This blue light, I should be wearing my blue blocking glasses, is dropping your melatonin levels down. And you're going to have a harder time sleeping. And guess what? That melatonin, which can be antiviral, is not going to be available for you. Now, if we keep doing this year after year in our bodies, we're going to age poorly. It's called inflammaging. We're not going to be able to control the inflammatory responses of our body. So it starts with those lifestyle interventions. That's how we really build immune resilience. You need immune resilience. So then when we get to the supplements, there's a lot of confusion. And, I heard a couple things today that I came across through emails and conversation with my colleagues about vitamin D and elderberry. And everybody's saying, there are even some professionals, very well-respected professionals, are saying you shouldn't take elderberry, you shouldn't take vitamin D. Vitamin D upregulates ACE2 receptors, and elderberry, will make the cytokine storm worse. The truth is that there's no, that those are very good immune modulating supplements. And I won't get into all the supplements, but I just wanted to really emphasize lifestyle. If people are interested in supplements, I'm sure you are, everybody asks me, you break them down into the categories of basically immune support, viral disruption, and I wrote another category here. You want to decrease inflammation, and you want to have antioxidant effects. So, there are basic things that I know you're all taking. If you're supplement, interested, I'd be more than happy to provide some more information. I don't know how much I should talk about those, but I would just mention a couple. Immune support, vitamin D, high doses, elderberry tea, stinging nettle tea, zinc, and of course, melatonin. I can let you figure out those doses. Viral disruption, quercetin and vitamin C, and for decreasing inflammation, resveratrol. So those are common. Everybody really knows about them, but those are the ones that I talk about with my patients. So when it comes to that final bookend that I wanted to bring up is the world organism. And as we're learning, we are connected. Everything's connected. And so we really need to think about, in the post-COVID world, how did this virus happen? Well, they think it may have been the Chinese horseshoe bat. Well, maybe it was, but the idea is that's called zoonotic transfer. And the reason why that happens is that a bat actually is very good at protecting itself from viruses until something happens. Its habitat is disrupted. And when we disrupt habitats all around the world, bats are not the only mammals who have their habitats disrupted, who become stressed. And when they become stressed, just like humans, their immune systems become less capable of fighting off virus. Then in places like China, where they have live wet markets, where they store animals in cages and then they slaughter them at time of sale, there's this mixing of blood with humans, and that's when these viruses can be they jump from one species to the next. The take-home message there is that you can't disrupt the ecosystem. You can't, have without accounting for flooding, disease, and carbon damage. You have to account for those. And so I hope as a world, as a community, after we get through this virus, we start to think more globally, and we start to do things that let us take control of our environment, protect it, and let it thrive.
Yeah, thanks, George. That's excellent. It's a really good perspective on multiple levels, which is what we wanted to kind of highlight to some degree or another tonight, certainly. I didn't just properly introduce Dr. George. For some of you know him, other people who may not. He is my very, very good friend and first boss from many years ago. And he currently is working at the Ultra Wellness Center in Lenox, Mass. That is the office created and founded by Dr. Mark Hyman, who many of you probably read or partake in his blog podcast. The Doctor's Pharmacy is the name that many of you may recognize. We want to just answer a few questions here. I'm just going to say briefly, tagging on what George was saying, I'm actually encouraging some patients to take this time right now where we are, in a downturn in our time availability anyway, to actually make the opportunity to use the opportunity to start new routines to having to do with the lifestyle stuff that George talked about, whether it's digging into nutrition considerations that you thought about doing before, whether it's starting some kind of exercise program. It can just be stuff at the house, which is sufficient for exercise in general, and maybe it builds from there later. Maybe it's meditation, whatever it may be. This is actually an opportune time to start new routines or to better establish previous ones. I'm going to let Jessica take the mic here and get to a couple of the questions here.
Yeah, so there's just a few questions and then we'll wrap up. But I did want to address a few things that people had asked through the chat. And one is, to what extreme should we be cleaning? Like when receiving packages, should we be wiping them down, et cetera, or just washing our hands afterwards? This is a great question that I have thought myself. And, you know, I think the reality is we probably should be wiping them down. I think just being careful, you open a package, being conscious to wash your hands. Washing your hands is better than the antibacterial soap. Actually, the washing soap is better. It actually kills the virus more accurately. But I think just being conscious of doing something, like when you're at the market or the grocery store and you're buying stuff, being conscious of what you're touching and sanitizing before you get in the car, et cetera, I think is important. Another question was, are you concerned we may be impatient as a society and loosen social distancing? I think that has yet to be determined. And I really think a lot of that's going to depend how severity there is a spike in cases. I think in New York City right now, where they're in crisis with 35,000 cases, they are not thinking at all about, oh, we want to loosen social distancing because it's so extreme. So I think, ironically, the better we are at mitigation, the more we're going to want to loosen those social distancing parameters. But I think it's important to keep those as strict as we can.
Can I make a comment on that?
Yeah.
And you tell me if I'm wrong, because this is based on what you've told me before. And I've talked about this with patients. So, you know, just for the sake of expectation, I didn't want to spend the time on it, but since this question provokes that question, this topic, you know, I've been encouraging some patients to try to establish some routines, as I just mentioned, partly because we are in this kind of new norm, right? I mean, part of my personal fear about all this is, as a person who likes to know what to expect, I just don't know what to expect. I mean, this could go on for 2-3 weeks, right? There's a lot of parents who are, or students who are saying, we're not expecting to go back to school at all. I mean, right now there's plans to go back on this date or that date, school dependent, but there's a lot of people who are saying, realistically, we're not sure it's going to happen at all. And I'm saying, okay, that speaks as an example, but much longer are businesses going to be closed? How much longer is this going to happen? That's going to happen? We don't know. I mean, could we be 4 months from now still be unavailable to certain parts of the business sector? We don't know. So in the meanwhile, how much can I establish a new norm for myself, whether that's an exercise routine or whatever the case may be? I need to establish a new norm because that brings sanity, that brings some structure, etc. And I think that's also important to this question because, and this is where, you know, you chime in if I'm wrong, Jessica has talked to me about that the big, one of the big take-home points from the Spanish flu in 1918 was the resurgence.
Yeah,
right?
yeah.
So why don't you speak to the resurgence?
Yeah, and I think, you know, if you look at even recent data of simulations done by Imperial College, they demonstrated basically if we loosen social distancing too soon, we're going to have a second surge that's likely to start in the fall that could be worse than what we have now. So really being strict about not loosening up some of these parameters as we are on the other side of this, not loosening them up too soon until we're really at a point where we have 0 cases or we have a vaccine or something is going to be critical to not having a second surge.
And I think the point there is to say that, so I thought you told me that it's important that people are keeping an eye on what's happening in Wuhan or South Korea because they may be down to an R0 of 0 or 1 or 0.8 or whatever, but if they start to loosen and then they start seeing the R0 rise again and they shut down again or they don't shut down, then that could be a real teaching point for what happens to us,
exactly.
right?
Yeah.
And so my real point on that is it's not unreasonable to start to now adapt mentally, physically, routines, whatever, to a new norm, because even if we loosen up and things seem to be moving back to norm, I mean, the other day, the NBA is talking about already when they start to restart games. And I'm going, where's that coming from, right? But if there's talk about that and then suddenly we have to shut down again, let's just at least have the possible framework of expectation in hand that, you know, we don't know what's going to happen.
Yeah. So I agree. Having a routine now and getting in a healthy routine, I think is going to be imperative to overall mental health. Just a few other questions here. One is, how significant is the connection between mortality rates in countries with heavy smoking culture? Well, I will say clearly, there haven't been a lot of epidemiological studies, but given that this is primarily a respiratory disease and people at the most increased risk are people who have things like COPD, which is a strong risk factor for it is smoking, they are going to be at dramatically increased risks. However, when you actually look at the epidemiological data, those who are at the most risk of extreme responses are not are not only smokers, but those who are obese with cardiovascular, different cardiovascular diseases or diagnoses, whether it be high blood pressure, high cholesterol, with being obese, et cetera, diabetes. Those seem to be the ones at the highest risk right now. Let's see here. Will there likely be an antibody test for those individuals who may have been infected and already recovered? I'm sure that is going to be something that they're going to be looking at. The question is, as the virus is mutated, is it an antibody test for one specific thing, or is this going to be more general? But yes, that's most definitely going to happen in terms of assessing who even would need a vaccine. Any thoughts about NK killer cells? Reports show shouldn't take fish oil supplements. So this is an interesting comment. It's about NK cells and the report suggesting that we shouldn't take fish oil supplements, dietary omega-3 fatty acids, EPA, DHA, long-chain fatty acids. This is actually my area of research, and I'm a real promoter of N-3 fatty acids in terms of protection of health in almost every way. The N-3 fatty acid chain is a pro-resolving anti-inflammatory chain. It's one of the strongest ways to protect your immune system. It goes completely against the other part of the cycle, which is the arachidonic acid pathway that has all downstream pro-inflammatory responses with all the bad prostaglandins that are pro-inflammatory. So I would still say be taking your fish oil, be taking any mediators, pro-resolving mediators in that pathway. That's where you want to be focusing.
Can I make a comment on that? Yeah. I saw that question. I was going to mention that. That's the exact physiology to it, and that the specialized pro-resolving mediators are actually really potent anti-inflammatories and very effective. And that is one of the supplements that I've been recommending my patients.
Yeah, and actually the one thing I will say about that today, I was just talking with a biochemist about this today, and specifically the pro-resolving mediators, not even the fish oil. Right. If you can get the pro-resolving mediators, are much more effective than the fish oil, which was one of my questions, because actually going down that chain to get to the pro-resolving mediators isn't always as successful in getting to that resolving mediator, but that should be a very a positive thing for this. Yeah, so I think that's it with questions. So
yeah, it's good.
Yeah.
So we went maybe a little longer than we expected, but we hope that was helpful for folks. I didn't think this out ahead of time prior, but had considered the possibility of asking, if this has been helpful to you guys, and over time, if we want to do an update over time or something like that, we may put that out there and consider that, or perhaps even if it's helpful to do some intermittent conversations on a more clinical level, that could be something we could think about. But be on the lookout through your Facebooks. We'll get some feedback from folks and see where we take it from there. But for tonight, thanks for participating. And again, the take-home message is this is hopefully these numbers tell the story about why the state and why the country, parts of the country, are doing what we're doing. And hopefully we will be able to buy ourselves some time to flatten the curve and make some progress. So thanks to Jessica very much for doing the super, super, super heavy part of the lifting for tonight. And thanks to Dr. George for your contributions as well. Good night to everybody, and be well, stay safe. Best wishes.
Thanks, everyone.
Thank you very much.
Thank you.
Thank you. Thanks.